Hello there, welcome to Dr. Sushant's anatomy tutorial. In this video, I am going to talk about the forearm. First, we will talk about the front of the forearm and then about the back of the forearm. So, we know that the forearm is invested by the deep fascia, and the name of the fascia is antebrachial fascia. So what is antebrachial fascia? The antebrachial fascia is nothing but the deep fascia of the forearm. This deep fascia is actually attached to the olecranon and the subcutaneous posterior border of the ulna. Olecranon process and the subcutaneous posterior border of shaft of the ulna. Shaft of the ulna. So that's the attachment of the antebrachial fascia. Now this antebrachial fascia, it sends a number of septa which extend from the deep surface of the antebrachial fascia between the muscles, and it reaches the bones. Right? What happens on the roof of the cubital fossa? The antebrachial fascia is reinforced by the bicipital aponeurosis. Right? Very close to the wrist, the deep fascia thickens on the anterior aspect to form what is called the flexor retinaculum. Similarly, on the back of the wrist, it forms what is called the extensor retinaculum. And these deep fascia it not only covers the muscles, but also it covers all the other structures in the forearm, such as the vessels, the nerves, etc. Now, the forearm is divided into two compartments. So there are two compartments in the forearm. Right. So what are the two compartments in the forearm? There is an anterior or the flexor compartment, which is also referred to as the front of forearm. And we also have the posterior or the extensor compartment of the arm, which is also referred to as the back of the forearm. Now, when you look at the muscles of the anterior compartment, that is the flexor muscles, they are more massive than the extensors because the flexor muscles, they work against the gravity. Therefore, they are known as the anti-gravity muscles of the forearm. So name the anti-gravity muscles of the forearm. It is the flexor muscles of the anterior compartment, which are known as the anti-gravity muscles. Now, first let us choose one of these two compartments of the forearm. So let's begin with the anterior compartment. So what would you call the anterior compartment otherwise? It can be called the flexor compartment, and it is also referred to as the front of forearm. Now, what forms the floor of front of forearm? So basically we have the bone and a membrane that stretches between the radius and the ulna, known as the interosseous membrane, forming the floor of the anterior compartment. So what we have, the anterior surface of the radius, and then we have the anterior and medial surfaces of the ulna, anterior and medial surfaces of the ulna, forming the floor of the ulna. The anterior compartment. And between these two bones, there is going to be the interosseous membrane, which is a syndesmosis type of joint between the radius and the ulna. Now, what is the demarcation between the anterior compartment and the posterior compartment? So medially, the anterior compartment is separated from the posterior compartment by the olecranon process. And the posterior border of the ulna. And laterally, the anterior compartment is separated from the posterior compartment of the forearm by the anterior border of the radius. All right. So this is how we demarcate the anterior and posterior compartment. Now let us take a look at the anterior compartment of the forearm. So here is the forearm that stretches between the elbow joint and the wrist joint, and it is covered by this fascia. This fascia is known as the antebrachial fascia. So it's like a sleeve that encloses all the muscles, vessels and nerves of the forearm. And you can see it is attached to the bones of the forearm, especially the olecranon process of the ulna and the subcutaneous posterior border of the ulna. Right. And the same fascia is thickened here in front of the wrist to form what is called the flexor retinaculum. So this is the flexor retinaculum, which is attached to the carpal bones. Similarly, on the back, there is this thickening of the deep fascia of the forearm known as the extensor retinaculum. And this fascia distally becomes continuous with the fascia of the hand. Right. Now, in the forearm, I just mentioned that there are two compartments, that is the anterior compartment and the posterior compartment. So here we can see some of the superficial structures lying in the, just superficial to the deep fascia. We have the basilic vein along the medial side of the forearm, along the little finger side, and along the thumb side we have the cephalic vein. So these two veins begin on the dorsum of the hand from the dorsal venous arch, right? And the ones in green color are the lymphatics going from the hand towards the axilla. Now let me remove the nerves, the arteries, veins, and the lymphatics. So we are left with the deep fascia and the muscles. Now let me remove the deep fascia, that is the antebrachial fascia. So we see two groups of muscles lying medially and laterally. So the muscles lying along the medial aspect are the flexor muscles of the forearm, and the ones that are lying laterally are the extensor muscles of the forearm. So how do I know medially and laterally? Look at the biceps brachii. This is the brachial fascia covering the biceps brachii. So here we have the biceps brachii muscle with its tendon and bicipital aponeurosis. So lying medial to the tendon of biceps brachii are the flexor muscles, and lying lateral to it are the extensor muscles of the forearm. Now what are the contents? So where is the anterior compartment? The anterior compartment is here, consisting of the pronator teres, flexor carpi radialis. This is the palmaris longus, and then we have the flexor carpi ulnaris more medially. This is the flexor carpi ulnaris, and beneath this we have the flexor digitorum superficialis. So these five muscles constitute the anterior compartment of the forearm. Right. So first let us talk about the anterior compartment of the forearm. Right. Now what forms the floor of the anterior compartment are the interosseous membrane, and we have the anterior border of the radius, the anterior surface of the radius, anterior and medial surfaces of the ulna. And limiting the anterior compartment from the posterior compartment is laterally the oblique line, the anterior border of the radius, and medially, actually, it is the posterior subcutaneous border of the ulna, separating the anterior compartment from the posterior compartment of the forearm. Right. Now, looking at the contents of the anterior compartment. So the anterior compartment of the forearm consists of muscles, vessels, and nerves. Well, so contents of the anterior compartment of the forearm. So what we have here are the muscles of anterior compartment. We have the nerves that supply these muscles, and we also have the vessels here. Now what are the muscles in the front of forearm? So let us look at the muscles in the front of forearm. So the muscles in the front of forearm, they are arranged in two groups, right? So there is a superficial group of muscles. They are known as the superficial flexors, and there is a deep group of muscles which are known as the deep flexor muscles. In the superficial group, we have 5 different muscles. So the superficial flexors of forearm consists of 5 muscles. The first one is pronator teres muscle. Second one is flexor carpi radialis muscle, and then we have the palmaris longus muscle, palmaris longus, and then there is the flexor carpi ulnaris. And beneath these 4 muscles, there's another muscle that's bulkier than the first 4 muscles. That's called the flexor digitorum superficialis. Flexor digitorum superficialis. So these are the muscles in the front of the forearm. In fact, the flexor digitorum superficialis lies in the intermediate layer. Now these are the superficial muscles, and then we have the deep muscles, which consists of 3. There are 3 deep muscles and 5 superficial muscles. So totally we have 5 plus 3, 8 muscles in the front of forearm. So what are the names of the deep flexor muscles of front of forearm? So we have the flexor pollicis longus, and then there is flexor digitorum profundus muscle, flexor digitorum profundus, and the last one being the pronator quadratus. So these are the muscles of the deeper aspect of front of forearm. So the muscles, these superficial muscles of front of forearm, they all have a common origin from the medial epicondyle of the humerus, medial epicondyle. Therefore, we know that the tip of the medial epicondyle is known as the common flexor origin. Well, so what are the vessels in the front of forearm? Let's look at the first. We will list all these contents and then we will go to the details. Now, what are the vessels here in the front of forearm? So we have the radial artery, we have the ulnar artery, right? And we have the branches arising from the radial and the ulnar arteries. And these arteries arise from the brachial artery. So even though we have this radial and the ulnar arteries in the forearm, they're actually going to supply the palm by forming the superficial and deep palmar arch. Therefore, the contribution of the radial and ulnar arteries as such in the forearm is very minimal. In fact, it is the interosseous artery, the common interosseous artery rising from the ulnar artery, which actually supplies most of the blood to the forearm. Right. So this interosseous artery that is arising from the ulnar artery is actually the chief artery of the front of forearm. Right. And the common interosseous, for your information, common interosseous artery divides into an anterior interosseous artery, and a posterior interosseous artery. So the anterior interosseous artery runs in front of the interosseous membrane and supplies all the muscles and the other structures of the front of forearm, and the posterior interosseous artery runs on the posterior aspect of the interosseous membrane and supplies all the extensor muscles of the forearm, or all the structures that lie behind the interosseous membrane. So, which is the principal artery supplying the forearm? It is the common interosseous artery through its anterior and posterior interosseous vessels, arteries. So, which artery supplies the anterior compartment of forearm? It is the anterior interosseous artery. Which artery supplies the posterior compartment of forearm? It's the posterior interosseous artery. Now, coming to the nerves, what are the nerves supplying the structures in the forearm? Right. So we have the median nerve, all right, and then we have the ulnar nerve. So median and the ulnar nerves mainly supply the front of forearm, front or the flexor compartment of the forearm, whereas the radial nerve through its posterior interosseous nerve, posterior interosseous nerve supplies the back of forearm. In fact, median nerve plus its one of its branches known as the anterior interosseous nerve supplies the front of forearm. All right, so what are the nerves supplying the structures of the forearm? So we have the median nerve and its branch known as the anterior interosseous nerve supplying all the contents in the anterior compartment of the forearm except a part of the the flexor digitorum profundus and the flexor carpi ulnaris, which are supplied by the ulnar nerve. So basically the nerves in the forearm would be the median nerve and its anterior interosseous nerve. It's a branch of median nerve, and the ulnar nerve and the radial nerve. So these are the nerves. For cutaneous innervation in the forearm, so cutaneous nerves of forearm that supplies the skin of the forearm are these. So we have the medial cutaneous nerve of forearm. We have the lateral cutaneous nerve of forearm, and then we have the posterior cutaneous nerve of forearm. So this medial cutaneous nerve of forearm comes from the medial cord of the brachial plexus. The lateral cutaneous nerve of forearm is actually the continuation of the musculocutaneous nerve. The posterior cutaneous nerve of forearm comes from the radial nerve. Right. In addition to this, we also have the superficial branch of radial nerve, which does not supply any structure or skin of the front of forearm. It actually supplies the back of the hand. In fact, 3.5 or 2.5 digits on the back of the hand is supplied by the superficial branch of the radial nerve. Alright, so but this nerve runs in the forearm, but it does not supply any structure of the forearm. Similarly, we have the palmar cutaneous branch of the ulnar nerve, palmar cutaneous branch of the median nerve. This is also going to supply the hand. It's not going to supply anything related to the forearm. Well, now let us talk about the muscles of the forearm. So what are the contents of the front of forearm? We have muscles, we have vessels, we have nerves in the forearm. Right, so now let us choose to discuss the muscles, okay, of forearm, the flexor muscles of the forearm. All right, so let me show you all the structures in the forearm. So arterial, venous, right. Now when I remove the muscles here, we can see that, let's remove the veins also. So we have the brachial artery here, right? So the brachial artery is dividing into the radial artery and the ulnar artery. So the ulnar artery gives you a branch known as the common interosseous artery. All right, so this is the common interosseous artery. The common interosseous artery can be seen to divide into two branches. One goes anterior to the interosseous membrane. This is the interosseous membrane, which actually holds the radius and the ulna together, and you can see this artery running on the interosseous membrane. That's known as the anterior interosseous artery. This is the anterior interosseous artery, and on the back side of the forearm we have another artery running, and that's called the posterior interosseous artery. So this is the posterior interosseous artery. So these interosseous arteries are branches of the common interosseous artery, which is actually a branch of the ulnar artery. Right. So now what are the nerves that we have here in the front of forearm? We have a lot of nerves here. Some of them are cutaneous, some of them are muscular branches. Now look at this particular branch running along with the anterior interosseous artery. This is now the anterior interosseous nerve. So this anterior interosseous nerve is actually a branch of the median nerve, and it rises just distal to the pronata teres. And on the back side, to supply the muscles, we have the posterior interosseous nerve. This is the posterior interosseous nerve, which is nothing but the deep branch of the radial nerve. And this nerve enters the back of the forearm by piercing the supinator muscle. The other nerves that we see in the front of the forearm are the ulnar nerve. So we see the ulnar nerve. Let's locate the ulnar nerve here. So ulnar nerve runs here after passing behind the medial epicondyle. This nerve can be seen here coming to along the medial border of the forearm. So this is the ulnar nerve. So ulnar nerve, anterior interosseous nerve, and the posterior interosseous nerve. So apart from these three, all the other nerves that we see in the forearm are the cutaneous nerves. Example, this is the lateral cutaneous nerve of forearm, and then we have the posterior branch of the medial cutaneous nerve of forearm, and then we have that's the ulnar nerve, and along the posterior aspect there would be the posterior cutaneous nerve of the forearm. Right. Now let us talk about individual muscles. I've already given you the list of muscles that we find on the front of the forearm. So we will discuss these muscles one by one, starting with the superficial group. Alright. So superficial group, the first muscle here is the pronata teres muscle. Let's look at the muscle. Let's remove the arterial and the connective tissue also. Let us remove the nerves. Right. Now let's just look at only the muscles. Right. So begin with the first muscle here. That's the pronata teres muscle. This is the pronata teres muscle. It runs downwards and laterally. As you can see, the radius bone is seen, the ulnar bone is seen. The pronata teres at its origin is also seen. So what is the origin of the pronata teres? So the pronata teres actually arises by two heads. One is called the superficial head that arises from the humerus. Therefore it's known as the humeral head. And then there is a deep head which arises from the ulna. Alright. So the deep head, the superficial head, that is humeral head, arises from the lower part of the medial epicondyle of the humerus. Right. And also it arises from the lower 1/3 of the medial supracondylar ridge of the humerus. Okay, so let's just write down the details here. So the first muscle we are going to talk about is the pronata teres muscle. Pronata teres. Right. Now, what is the origin of a pronata teres? So the pronata teres muscle has got two heads of origin. One is called the superficial head, facial head, and the other one is the deep head. So the superficial head is from the humerus and the deep head is from the ulna. So what passes between the superficial and the deep heads of the pronata teres? We have the median nerve passing between the two heads of the pronata teres muscle. So the superficial head, also known as the humeral head, arises. The humeral head arises from the lower 1/3 of the medial supracondylar ridge. I believe you remember the medial supracondylar ridge. If you do not remember, please go back to my video on the osteology of the humerus. The shaft of the humerus. So lower 1/3 of the medial supracondylar ridge provides one of the origins to the humeral head of the pronata teres. We also have the antero-inferior aspect of the medial epicondyle, providing another origin to the pronata teres muscle. Okay, so this origin is the common flexor origin, that is from the anterior-inferior part of the medial epicondyle. As common origin of the superficial flexor muscles. Now the ulnar head of the pronata teres arises from the medial border of the coronoid process of the ulna, distal to the origin of the flexor digitorum superficialis. So medial border of the coronoid process. Okay, not the olecranon, it's the coronoid process. And this origin is distal to the origin of the flexor digitorum superficialis. So I believe you remember the medial border of the coronoid process. The medial border of the coronoid process provides origin to 2+1 muscles. The highest origin of the flexor digitorum superficialis, and then we have the origin of pronata teres, and then occasional head origin of the flexor pollicis longus muscle. from the medial part of the coronary plexus. So this is the origin of the pronator teres muscle from the humeral head and the ulnar head. Now what lies between the two heads? The median nerve. Okay, the median nerve passes between the two heads of the pronator teres muscle. Now coming to the insertion of this muscle, the pronator teres muscle is inserted by a tendon. Okay, so it proceeds towards and laterally, forming the medial boundary of the cubital fossa, and it is inserted by a flat tendon. It is inserted by a flat tendon into the middle of the lateral surface of the shaft of the radius. Okay, middle of shaft of radius, where on its lateral surface. All right, so middle of the lateral surface of shaft of the radius. That's the insertion. As you can see in this picture, we can see the insertion by a flat tendon into the middle of the lateral surface of the shaft of the radius, right? So that's the insertion. Well, now coming to the nerve supply of the pronator teres. Obviously, the pronator teres muscle is supplied by the median nerve, and branch to the pronator teres arises while the median nerve is in the forearm. Now, what is the action of the pronator teres muscle? The pronator teres muscle is actually a pronator, as the name indicates. It's a pronation of the forearm, and because it's a flexor muscle of the forearm, it's a weak flexor of the elbow joint. So the nerve supply is median nerve, okay, and the branch arises in the forearm. What about the action? The action of the pronator teres is, one is the pronation of the forearm, and also it's a weak flexor of the elbow joint, right? So that's about the pronator teres muscle. Our next muscle is the flexor carpi radialis.